Hi, this is Dr. Christopher Maloney, naturopathic doctor in Augusta, Maine, talking about carpal tunnel syndrome. Now, carpal tunnel syndrome is something near and dear to my heart because it's one of the reasons I became an alternative doctor. When I was in, my wife was in law school, she got carpal tunnel so badly that I had to feed her for a period of time. And we went to all the specialists, we were down in Boston, and they weren't able to help. In fact, they said, you know, you've got to live with it, here's some splints. And we did a lot of reading, and we did a lot of interventions, and to her credit, my wife has actually healed herself. I really can't take credit. She really took the steps that she needed to take to get well from carpal tunnel without surgery. Now, I mean, be clear, and I'm not opposed to the surgical, release of the median nerve, but what I've seen is that typically the model that people are using is, hey, I can have my wrists released and I'll go back out and do whatever the heck I want with my arms. And that really is a mistake, and it's really, I think, an error on the part of the hand surgeons to allow people to do that. I think they really need to retrain them in how to use equipment efficiently. And it's not, ergonomic is not an option. If you're doing something 8 hours a day, your median nerve compression is the first sign that you're having problems. Typically, I will also see problems up here in the neck, brachial plexus area, what was previously called thoracic outlet syndrome here in the pectoral muscle, and the forearm. Usually the forearm is actually, the smaller tendons in the forearm are just fried and constantly under tension. So these people are putting off a problem if they're just getting the surgery and then saying, hey, I'm good to go. You really want to address the whole arm and the whole neck region, because what will happen later on is you'll have other issues that theoretically have nothing to do with the carpal tunnel but are really a 10 to 20 year result of the same behavior that gave you carpal tunnel syndrome. One of the simplest things that I have, that people come in and they'll say, I have this problem all the time, and I would say, well, why don't you switch your mouse hand? At this point, a lot of us are still using our right hands. We'll use them 8 hours a day. You need to become ambidextrous with the mouse. The mouse is not a complex machine. It's not learning to write longhand again. It is something that you can learn to click with your left hand and move a little thing around your desk. Typically, also, I would discuss things that we have the voice activation software. When we first worked with it back in 2000 oh, actually no, it's 95. Was pathetic, and now the voice activated software is much more. It's really quite impressive. And if you type less than, say, 40 words a minute, or you typing, if you're pick typing, I do recommend discussing voice activated software. So if you're experiencing carpal tunnel, it's the first sign of other problems in your body, and you are better served to treat yourself appropriately as a whole body system rather than simply a wrist. If you get the surgery, wonderful, but do take the time to retrain yourself. Do ask for physical therapy afterwards. And then for the rest of you who have what is not called carpal tunnel but is actually a repetitive strain injury of some kind, these can be dealt with in the same way. You really can look at a repetitive strain, a model, and say, look, what are you doing wrong consistently? We really need to have more physical therapists involved. This occupational therapists and ergonomic specialists should be just commonplace, visiting the different workspaces, because it's really going to be very important as we go out long term. People are really abusing themselves both at work and at home. So this is Dr. Christopher Maloney, naturopathic doctor in Augusta, Maine, talking about carpal tunnel syndrome. Thank you.